I wanted to go back to what you were talking about with Dr. Dickholt Sr. and your experience there with being an associate and learning from a high standards environment, right? An environment that really challenged you and pushed you, and maybe wasn't always the kindest way of delivering the message, right? And I know from personal experience too. I was in classes with Dr. Dickholt Sr. and I knew how he was and that type of thing. And I had other great instructors who had a similar type of personality or maybe a little bit of abrasiveness, but like Dr. Alberti and others that are like that, right? So but I'd like to talk a little bit about that, because I don't know if sometimes maybe students or associates or whatnot don't understand the why. Like, why are doctors like that? Some doctors like that. Dr. Dickholt Sr., Dr. Berti, other doctors, why do they have that drive within them? What is that is driving them to be like that?
So I can't answer that for him.
Yeah.
I know it existed, and I know it was always a driving force within the practice. And as an employee, it was an expectation. So the thing with Dr. Dickholt is when he was with patients, again, it wasn't the warm, cuddly. There were definitely times where, because my job was, I'd be in the room with him when he'd be seeing patients as an associate. And because I was learning, so he would do the thermal scan, and then he would, he'd always start with the leg check and thermal scan, and then the anatometer. And then if they needed an adjustment, he'd have me set them up on the headpiece, and then he'd check it. Okay. And then I would take them after he did the leg check. Then I'd take them and I'd do the final anatometer reading, because I was in a little different room. And then he would see the next patient. And so in the room where I was doing that final anatometer check, then there were times where, like, he offended somebody, and they'd be like, "What the heck? Like, what is that about?" And I'm like, "Look, that's just how he is. I'm sorry you had that experience, but he really does care about you." So the thing with him, though, is when you see those post x-rays, there's this like competitiveness about it in a way. It kind of touches on that chord where you really want it to look awesome. You really want to have that post x-ray look fantastic. And he was definitely about that. But it was because, like, he was dead honest with people. He was, like, almost to a fault. If they were not protecting their adjustment, they would hear it. They would know they did something wrong. Okay. Yeah. But it all was rooted in the fact that he wanted to help these people. And I think when you see miracles happen, and they're not all miracles, but when you see some, it catches you. It like gets you so excited about seeing it again and knowing the potential. You also know what, like, a partial, not a maximal correction is missing. So I think that's where the passion comes in, is you see miracles happen. You see a post x-ray, so you know what happened. You see, you have an experience if you're someone like Dr. Berti and like Dr. Dickholt and all the other incredible NUCCA doctors we have out there that they know their biomechanics, they know how to reduce a subluxation. Like, there's this drive, like, we want that maximal correction, because that can change this person's life. Right. And it has to come from that place. course, egos can play a part in this, good
Yeah.
or bad.
Yeah.
But honestly, I think his patients, they stuck with him because they knew he would work his butt off to get them corrected, even if they were a little offended along the way.
Right. Right. Yeah.